Our next speaker is Wenjun Miao. He's he's a doctor in pharmacy and obtained his degree in the Seoul National University. He worked at the Korea Advanced Institute of Science and Technology, and currently he is an associate professor at the School of Pharmaceutical Sciences of Nanjing Tech University. He is specialized in the research and development of multipurpose nanodrugs and nanoprobes for the diagnosis and treatment of major diseases and surgical navigation. He's going to speak today about photoresponsive nanoparticles for image-guided tumor surgery and therapy.
Okay, thank you, Laura. It's my great pleasure to be here, to be Zaragoza, to give a talk here. It's my first time to be here, and I enjoy this kind of conference, and thank you for organizing and invitation. My name is Wenjun Miao from NJ Tech University. My college is pharmacy. My major is pharmaceuticals. Today, my topic is photoresponsive nanoparticles for image-guided tumor surgery and therapy. Cancer still remains the main diseases in China with high incidence and population higher than average level worldwide. And the overall survival rate of Chinese patients is also lower than the average level. For the treatment of solid tumor, surgeons generally resize the tumor first, then followed by radiotherapy, chemotherapy, or immunotherapy, which is very popular recently. But anyway, they generally cut and resize the tumor first. Less than 10 years ago, the near-infrared fluorescence imaging system are used to help the surgeon to localize the tumor boundary and location and the size. And they generally use some dye to visualize the tumor region. And under the imaging system, the surgeon can recognize the size of tumor. The right panel is an example of the ovarian cancer on the NIR imaging system. And the blue part is the cancers. One of the contrast agents used for NIR imaging system is indocyanine green, short for ICG. It's a triple carbon cyanide dye. Its excitation emission wavelength located in the near-infrared range, about from 780 nanometer to 820 nanometers. And now in this range, the light penetration depth is, to the tissue is the highest, and the light for excited the dye and the light emission from the dye can be easily detected by the systems. Moreover, the ICG also multifunctional. Besides using as a fluorescent dye, it has photodynamic and photothermal effect, which can be used for tumor treatment, which we call tumor phototherapies. However, ICG also has some drawbacks, such as the very short half-life in vivo, only in 2 to 4 minutes in blood circulation, and also has some side effects and also very poor physical and photostability. So there is a need to develop a novel photoresponsive materials for this kind of imaging guided system. Due to the large surface area of intrinsic property of graphene, I use the graphene here as a carrier for the ICG. The system I call the CHRGO, means the surface of graphene is modified by hyaluronic acid for active targeting. we optimize the loading efficiency of ICG onto the CHA and RGO and measure the size and the potential of the particles. And interestingly, we found that because ICG itself is very easy to be light-induced degradation, you can see upon 1 minute irradiation, this kind of peak faster disappeared. However, upon loading onto CHA-RGO graphene system, this peak still remained over over 5 minute irradiation. So that's leading to the synergistic photothermal effect of the system. In the in vitro cell level studies, we found when ICG loaded onto CHA-RGO, it very easily to be uptaken by cancer cells, and upon irradiation by laser, the temperature of cells increased rapidly, very high. Even after 1 minute irradiation, the temperature of cells reached over 16 degrees, thus leading to a very potent tumor cell killing effect. We also constructed a tumor model in the mice after intravenous injection of the CHA-RGO loaded ICG. We found in a tumor tissue there's a very strong accumulation of our system on a particle. In the ex vivo system, we found in the tumor region, the intensity is 4-fold higher than the non-active targeting systems. Also, in the tumor tissue, the intensity is higher than the liver and the kidney. In this system, we know the location and size of the tumor, then locally irradiate the tumor by a laser and monitor the temperature change of the tumor. Also monitor the tumor volume over time. We found the tumor get burned and no recurrence over 25 days. Moreover, we performed the tissue analysis. We found that in our ICG-loaded CHA-RGO system, the tissues shows very low level of the cell proliferation markers and a high level of apoptosis markers. But the application of a graphene-based system, especially used in vivo, always questioned by people because of the safety issues, and moreover, this fabrication process is very complicated, and the quality control is also a concern. So maybe it's very difficult to find this way for graphene to be used in clinic. So I turned my attention to organic-based system. Still, I also use the indocyanine green, but now I changed to use its derivatives. And based on the rational design and the combination of ICG derivatives with biocompatible polymers, I try to construct novel near-infrared fluorescence polymers to have the biocompatibility, tumor targetability, fluorescence, and phototherapy abilities. For ICG derivatives, I changed the I modified the side chain number, length, and the functional group of ICG. And then for biocompatible polymers, I use the FDA-approved polymers such as polyethylene glycol, polymer, and polyamino acid, and so on. Here, I only report one of our polymers we call cyprid PEG, actually, composed by ICG derivatives and polyethylene glycol. Its molecular weight is about 2000. After characterization, the polymers, because its polymer is very amphiphilic, so it can self-assemble into nanoparticles in PBS with the size of about 60 nanometers. And we found that our nanoparticle its absorbance is resembled to ICG, especially in the near-infrared range, with the same absorption peak, about 800 nanometers. With the same concentration of a free dye and a nanoparticle, interestingly, we found our nanoparticle shows much stronger fluorescence intensity compared to free dye, about 4-fold. And moreover, because the ICG itself is a photo degradation, so this nanoparticle also rapidly decomposed by light. During this process, ROS and heat can be generated. In cell studies, we found our fluorescent nanoparticle can be rapidly uptaken by tumor cells and shows about much higher than free dyes. And also that there are intracellular ROS and heat generated in the tumor cells, also leading to the strong tumor cell killing effect even under very low light intensity. And for in vivo imaging system, we inject the free dye and our nanoparticle into tumor-bearing mice, and we found in case of free dye system, we cannot easily detect the tumor, because probably due to the long circulation time and the poor tumor tolerability. However, in case of our nanoparticle, we can see from 2 hours to 24 hours, we can easily detect the tumor by fluorescence imaging system. Same, we irradiated the tumor by a laser. We call fluorescence imaging guided tumor phototherapy, and also monitor the temperature change of the mice. We found the temperature increase over than 14.5 degrees after 10 minutes irradiation. Also inhibit the tumor growth over 15 days, and also extended survival of the mice. In tissue level, we also found for HE staining and immunofluorescence staining, we found the nanoparticle plus laser system can induce the cell density in tumor tissue, also induce the autotoxic marker expression level. Here, the marker used is the BRD. You can see this in this group shows a very strong autotoxic level. Okay, I'm going to make a brief summary. After screening the different derivatives and the polymers, I established a novel fluorescent polymeric nanoparticles, which is quite biocompatible and also can be used for tumor imaging using fluorescence. Also can be used for phototherapies. This is my advisors and collaborators, and also get a foundation from Chinese government. This is my group. My group is as young as me, actually, only 2 years old. Okay, thank you for invitation, attention, and welcome to Nanjing Tech University, hopefully next year. Okay, thank you.